chin implants that are commonly used. There's a silicone type, and then there's a porous polyethylene type. I like the porous polyethylene. It's basically a firm plastic. There's a bunch of little holes in it. So you can think about it as like a really firm, like rigid foam or sponge. The reason I like that is twofold. One, it has been shown to cause a little bit less bone resorption, or basically no bone resorption. And then also I like it because the soft tissue, so the underlying periosteum and the muscles, that attaches to the implant because it's got this porous, this rough structure, if you will. And so it basically is replicating the texture, the surface of the bone, so that those soft tissues anchor to it. So it's as if you're adding bone. You're not, but it's as if. Okay, so the one I chose today, and we're gonna come and look over my shoulder here, is a two-piece implant. It's two-piece so that you can assemble it inside on top of the chin and the jaw line, and not have to make a really large incision because it's rigid, remember? So we need to be able to get it in there. If this came as a complete horseshoe, if you will, then you'd have to make a much larger incision. So this assembly capability allows you to use a very small incision, a very difficult location to see. And for this patient, I chose 3 different profiles. We've got let's just verify, we've got the 5, so that's the middle one, the one we're probably gonna use. This one is the 7. We may use this if I feel like she needs a little bit more of a augmentation. The nice thing about these is that I can carve them. So if I do choose this and I later feel that it's too big, all I have to do is use a scalpel and I can trim off some and basically make it a 5. And this is a 3. I really think it's unlikely I'm gonna use that because it really wouldn't provide a lot of result. But I love this because it came pre-assembled. Of course, there's a little seam there. I can undo that seam, just pull it apart. It's like a Lego sort of, and then stick it inside the body, one piece, then another piece, and then reassemble it. And you can compare that to these 2 pieces that I'm gonna be able to assemble inside the chin, inside the jawline. This part here is this part here, and then this other part you see there would be flipped, and it's like that. And then we stick it in, and then we place 2 little screws, sometimes 4 little screws, so it doesn't move. And that's where it becomes really like bone because it's anchored there. So there you are, the 3 different sizes that I ordered. And this is the MedPore surgical implant, the contoured 2-piece chin. Powerful stuff. So here you can see I've injected some local, so her chin doesn't look as weak as it actually is, but you can see it's weak. And when she was awake, standing up, I marked the lower part of the jawline. And then also I marked where my incision is gonna be. Now, the incision is unlikely to be this large, and you guys may be thinking, wait a minute, why, external chin incision? The reason I like an external chin incision is, one, I think it'd actually be very difficult to do the MedPore implant through an intraoral, so like behind the lip incision. But 2, I like to do an intraoral incision because you don't have to cut through the muscles that help support and move the lip. Now, if you do have to cut through them through an intraoral incision, that's fine, they're gonna heal. But if I can avoid that, and I like to avoid it. And then the other reason I like to go beneath the chin is that when we're freeing and liberating all the tissues to create a space for the implant, we leave all that other tissue here intact inside the mouth, and the chin implant actually helps push the lip up, which is important because in people with weak chins, often the lip is a little bit too low, and they really have to strain, really have to move their lip really hard or think about closing their lip. And so this this external incision allows for a phenomenon in which the lip and the chin tissues are not just pushed forwards, but really supported up. It's kind of like a little internal ledge or shelf that's helping support things. All right, so I've dissected down along the jawline, and you guys may be thinking, well, gosh, that's pretty far, that we're just working on the chin. And yes, the primary impact of the implant will be the chin, projecting it forwards, but we also have the benefit with these implants of a very nice fine taper along the jawline going posteriorly, so there's not a step off, not this weird projection only in the center. Sometimes patients need that. And then these are the sizers, and you can see these are like some silicone. They can be re-sterilized. And this is the 3, so that's the least projecting of the one that I have. This is the 7, the largest, and you can see how that may very well be too large for her. This is the 5. This is the one that, and by 5 I mean 5 millimeters. This is the one that we thought was going to be the best for her, just based on our predictions, based on some modeling that we did in the office. So I'm actually going to start with the one that's most likely, and you can see how we slip it in there. And then let me get a rag now. It may be helpful. Be a little slippery. There we go. All right, now let me get a pickup real quick. Angela came out a little bit early. That's okay. She's not always with us. Okay. Now, so you can see how that creates an augmentation for her. And I really do think that that 5 is gonna be what she needs. I'm later gonna cut this tube here and place it behind her teeth so I can really close her jaw, her teeth, and then I'm gonna look at the whole face. But I'm already thinking that this is the one that we're gonna use. So what I have done is I've also dissected upwards until I get close to where I see the dissecting device, the elevator here. And the reason for that is, remember, we're really trying to create enough space that the implant has a maximal effect. It's gonna decrease the really deep labiomental groove that was here, and it's gonna create a better balanced appearance there. And remember, it's gonna help support and push up the lip so her smile is more natural. Important to see what her chin looks like in comparison to the rest of the face, or so that we create the facial harmony. And I'm gonna show you a maneuver. Sometimes we'll do the tube through the nose, nasal intubation. In this particular patient, we did it in the mouth, and we can't close that, right? So what I'm gonna do is I've released the tube temporarily, and I'm actually gonna stick the tube behind her teeth so that we can close her jaw, and we can see what that's gonna look like. Now, I can't show you the rest of her face. That was part of what she had asked of us. But well, you can see this, and you can see how that's a very nice chin augmentation, that the weakness from side to side in the anterior jawline is corrected by those little tails that taper out. I love the way that this looks. It also gives us a really nice hollow here, so it's almost like a buccal fat pad reduction. We see this really nice structure. We're gonna go with the 5, and I don't think I'm gonna have to carve or shape it at all, because it's as if this implant was made for her. Okay, so here's the chin implant. Mari has already pre-treated it with betadine. It's actually 50-50 betadine, which is great. I like to not touch the implant at all while it's dry. That way we keep it super clean. And then I'm gonna show you something really pretty cool. So we're taking the implant out, all right? And then remember I said it goes together. This is how it would go into the jawline. It assembles inside the jawline just like that, okay? So now, remember I told you there's all these little, they're not microscopic, but they're these little tiny holes in the implant. And what we want to do is we want to get those little holes filled with this cleaning solution as much as is possible. And last time we did this, we had a little joke when that happened. And then I don't know if you can see this, but some of the air is bubbling out of the implant, and that was replaced with this antibiotic irrigation so that we know that we're like super, super clean. And now I'm gonna put one side in and then the other side in. My wonderful team over there is going to cover everything but the lower lip below, and you'll see me be able to put this in. I'm gonna make sure that these are not compressing the nerve. And then we'll put the little screws in, and we will be all ready for her to enjoy the rest of her life with a beautiful chin. You can see this goes right in here, and I can see the nerve. This is well, I keep saying the nerve. So, you know, one of the goals is to not injure the nerve that creates sensation in the lower lip and part of the chin. And so we want to make sure that this implant fits in a way and is positioned in a way that it's not going to hurt her nerve. And I just saw that we did this, and then I'm gonna come over to this side because vision is key. And then we're gonna put this other side in here. You can see it sliding in. Sometimes we have to just kind of adjust a little bit there, okay. So I'm meeting some resistance. I'm gonna look and see why am I meeting resistance. And I think this side could benefit from just a little bit more of the section slightly further back, just to give it a nice place to go to. Oh, actually, this is dissected really far back. I think the issue was that because it is a little bit rough, it just needs a really nice clear pathway. And so we'll do this. There we go. Okay, there we go. The bone here that I just need to free up so that we got all the space that it needs. Just being really careful because we're near the nerve here. All right, so now it has all the space that it needs. All right, now since I'm right-handed, I'm gonna come back to this side when it fits together like, I don't know if Lego is the right word, but it does snap together here. We're all finished here. You can see those really nice contours that it creates for the jawline. And it just smooth, it tapers up to that chin augmentation. And then very tiny incision here, very well hidden. Her skin complexion is gonna nearly disappear. And the little bandage is just gonna be an itty bitty little steri strip. Why don't we make it just basically the length of that so she has like no overlap, so she knows exactly how long it is. And okay, very nice. We're gonna trim that. That's beautiful. And then we're gonna cut this little suture. Oh, I like how you chose the naked color, the flesh color. Flesh color steri strip, you can barely see it. Okay, very nice. Maybe hard to see. In fact, I'll bet it's impossible to see. But I put this is the seam together. This is where the two halves came together, united as one forever inside her chin.